Neonatal hypoglycemia is defined as a blood glucose of less than 40 milligrams per deciliter. There are basically two core treatment pathways: oral treatment with glucose gel or intravenous treatment with a dextrose solution. The route chosen depends on the severity. IV dextrose is used in neonates who are symptomatic or asymptomatic with severe hypoglycemia, or they are unable to receive oral treatment. 10% dextrose is given as a bolus in severe cases of neonatal hypoglycemia. It is dosed as 0.2 grams per kilogram that is administered over 1 to 2 minutes. A 10% dextrose solution contains 10 grams of dextrose per 100 ml. The bolus dose of 0.2 grams per kilogram translates to 2 ml per kilogram, which are the units you will typically see ordered. A continuous infusion of either D5 or D10 may follow, titrated to achieve a target glucose level of 50 to 200 milligrams per deciliter. There are 3 major pitfalls to avoid when using IV dextrose in neonatal hypoglycemia. First up is rebound hypoglycemia, which can occur when intravenous dextrose is abruptly discontinued. The ratio of insulin to glucose immediately after abrupt discontinuation is so high that it can cause glucose levels to tank. I explained this concept more fully in the video on TPN administration. The second pitfall is errors concerning dextrose concentrations. 5%, 10%, and 12% dextrose are the concentrations that should be used in neonatal hypoglycemia. Higher concentrations of D25 or D50 should never be directly infused in neonatal populations, as they pose a high risk of vascular injury when administered through small veins. The final pitfall is performing alligation. Alligation is a mathematical technique used to determine the quantity of 2 concentrations needed to create a desired concentration. The desired concentration will have a value somewhere in the range of the 2 starting concentrations. If a baby is not responding well to D10, at some point we will have to increase the concentration instead of the rate because of the limited volume they can safely receive. Though there are commercial preparations of D12, in my 12 plus years of experience, I've always had to compound it using alligation. It is not used very often, so most pharmacies will not stock it. I show 2 ways to perform alligation over at pharmacology.com, including sample questions using both methods. Discover which approach works best for you. Now let's take a look at glucose gel for treating neonatal hypoglycemia. 40% dextrose gel is indicated in mild cases of asymptomatic hypoglycemia. This is a baby who is able to feed, clinically stable, and not in any distress. Just like the bolus doses of D10, the 40% dextrose gel is dosed at 0.2 grams per kilogram per dose. 0.2 grams per kilogram of a 40% glucose gel translates to 0.5 ml per kilogram. To administer the gel, first dry the mouth with gauze, then massage the gel into the inner lining of the gums, and follow that with feeding the baby. Head over to pharmacology.com to access the full